Enter the room.
It started.
Hello,
Hi, doctor.
am I speaking to Cameron Davis?
Yes, this is she.
Okay, so I'm Dr. Firoz. I'm calling from the GP surgery. Okay, I understand that you made an appointment, so I'm calling for that. So is it the right time to talk?
Yes, I'm all right to talk. Thank you for calling.
Okay, so before we proceed further, so if the call drops by any chance, then is it the same number I can call you back?
Yeah, yeah, sure. You can get me. You can reach me on this number.
Okay. So, and okay, I'd also like to make sure that I'm talking to the right person. So, can you please confirm your age as well
I'm 70 years.
and your first line of address, please?
I'm in Manchester 123.
Okay, so is it okay to call Davis?
Cameron is fine. Carmen is
Okay,
fine.
okay, Carmen, nice to meet you. So, I understand that you have some concerns. So, can you please tell me more about it?
Yes, actually, it's a little embarrassing, but I have this lesion on my left breast, and it's been there for a while, but it's kind of, I feel it's kind of getting bigger, so I'm a little
Oh, I
worried
see.
about it.
Okay, so you mentioned to me you have this lesion over your breast, and can you please tell me like how long it is exactly?
It's been a while. I would say a few years. I would say around some 20 years. I would say it's been there, but it's kind of it's
Mm,
getting bigger and it rubs against all my clothes. It's very irritating. So yeah, now
okay.
it's kind of bothering me.
Okay, so what is the size? Can you like is it the pea size or any what kind of size is it?
I mean, I would say it started like that, but now it's slowly over time. It's very insidiously getting bigger. It's pretty big. I would say about some 4 centimeters, 4 into 4 centimeters. Yeah, it's round in shape.
Okay, it's round in shape. Okay, and okay, when you touch it, do you feel is it freely movable or attached to the skin?
It's attached to the skin. It feels a little waxy.
Okay. And is there any, what about the temperature? Temperature is normal over it?
Oh yeah, yeah, absolutely. There's no problem there.
And what is the color?
It's kind of black in color.
Okay. So during this whole period, is there any recent changes in the color, shape, or size?
I mean, it's been growing over time, but very slowly. Like, I wouldn't tell the difference in a month or so. Over years, I can say that it's grown a lot.
Okay. I'd now look over your lesion. You send me that picture.
Okay, sure.
Okay. And what about the surrounding structure? Like, is there any bleeding over it?
No, doctor, there's no bleeding.
Any discharge
No, doctor.
or any ulcer formation?
No, no, nothing, doctor. There's nothing.
Okay, and apart from this, do you have any lumps or bumps in any other parts of your body?
No, it's just here.
Okay, and what about that? Like, do you expose to sun a lot?
I have a house in Spain and I go there a lot, and yeah, I sunbathe quite frequently.
Okay, and what about that? Okay, so did you do any skin artificial tattooing in the body?
No, not really. I have no
Okay,
tattoos.
so do you have any weight loss recently?
No, no, not that I've noticed.
Okay, and so okay, do you have any long-term medical condition?
No, I don't actually.
Okay, and are you taking any kind of medication regularly?
No, doctor.
Okay, and anyone in your family having any same kind of skin condition?
Well, my mother and my sister, they kind of had skin cancer.
Okay, I'm really sorry to hear about that.
Yeah.
Okay, so
But they're
what
all right now.
okay, and what do you do for the living?
I'm retired,
Okay,
actually.
and before that, what you did? What occupation?
I was a manager in a company.
Okay, and okay, that's good. And do you have any who do you live with?
Currently, I'm kind of living alone.
Mm-hmm. Okay, do you smoke?
2 minutes remaining.
No, doctor, that's kind of an odd question to ask. Of course not.
Okay, so okay, I'm sorry if I offended you. And do you, by any chance, do you drink alcohol?
No, not really. Is that relevant,
Mm-hmm.
even?
Mm. Yeah, okay, understand. Okay, so do you have any idea what might be the cause of this skin lesion?
I mean, until now, since it was, it wasn't bothering me as much, I've been starting to get concerned. I think it might be cancer. I mean,
Mm-hmm.
my sister had it as well.
Okay, okay, we'll look into it shortly. And so you're worried about the cancer, and so how it has been affecting you because it's for a long time.
I mean, it wasn't affecting me until recently. Like I
Mm.
mentioned, I've been having this. I mean, it rubs against my clothes, so it gets irritating. Like I mentioned.
Okay, okay. So thank you for answering my question. I'd now examine your blood pressure, pulse, temperature, your breathing rate. Okay, I'd like to check
Do I have to
that
come to the
skin.
hospital for that?
Yes, from what you have said, and after that examination, it seems you are having this malignant melanoma.
What is this
Do you have any
malignant
Do you
melanoma?
have any idea about it? It's
No, not really. What is it?
yeah, it's a type of skin cancer. Okay, and
What?
as you mentioned to me,
What you're
yes,
saying? I'm having cancer?
yeah, I'm really sorry that I'm giving this news to you. Yeah, this is
Why,
one kind of
doctor?
skin cancer.
Move on to the next station.
I don't know, but I didn't check the picture.
And you will have the patient information. You will also have the what will say the picture, as well as you will have the candidate information. These are the information. These are all the information that you will have, right? And you're supposed to make the consultation, so you can't do any other physical examination or anything like that.
Oh, okay, sorry, I forgot. Okay.
I think you got confused in between. You understood that it's telephone, right? So in telephone, you don't have to mention
Yeah,
everything
but in the
that.
middle, I forgot that I forgot
Yeah,
telephone.
Yeah.
because since we're doing all the stations like this, that's why it might be that you might have
Okay.
forgotten.
But there you won't get confused like
Because
that. It's
you will
fine.
be in a room and you will be talking on a phone
Hmm.
over there, so it's very unlikely that you'll forget.
Okay.
But that's all right.
And one thing, could you could see the timer and you could hear the audio prompt, right?
No, I think so.
Oh,
Oh,
you
you couldn't
couldn't hear.
hear the audio prompt?
Okay,
Okay,
okay.
okay.
No, no.
Hmm. And you can see the screen, right? The whole time. The timer also changes
Yeah,
colors
but
with.
I was asking for this picture. I think I didn't saw the see the picture. That's why I
Okay.
couldn't diagnose it.
Wait, you couldn't see the picture at all? Are you on your phone?
No, yeah, yeah. That is
Okay.
I'm saying.
All right. Okay. Okay.
I
Okay.
just from that information I told you because I couldn't see this
But can
picture.
you? It's not screen sharing. It didn't show the picture while screen sharing.
No, it's just a fixed. This is the fixed skin.
Okay. Okay. You could only see now. Can you see the picture?
The yeah, no. Just this is only wait. Oh, sorry, this side. Oh, I didn't check it.
Oh, okay,
Oh, you didn't see
okay.
it. Okay,
So
okay. It's zoomed in
it
now.
was zoomed in. Okay,
Oh,
okay.
that yeah, I zoomed it. Then I didn't. That's why I was just asking this
Right.
picture.
Okay,
Sorry.
okay. Because
Okay.
yeah, it was not on 100%. Okay, understood.
Okay.
But
Yeah,
that's
that's
all
sorry. I
right.
think. Yeah.
No
Okay.
But
worries.
Okay. Now this is my mistake because I didn't check. I was thought maybe it will come by itself.
okay, okay,
Okay.
understood. That's why there
Yeah.
was a little bit of a pause once the picture I revealed the picture. Okay, understood. But
Okay.
that's all
Okay.
right. But
Yeah.
in the station, usually the picture will be there already.
Hmm.
There will already be the candidate information, that is, the question, and the patient information, that is the first name, address, all that will be there with you, and you'll be talking on the phone, right?
Okay. I
So
understand.
you can't forget that it's not a telephonic conversation. For sure. But
Oh, sorry.
that's all right. Good job.
Yeah.
But then you've spent a lot of time in history taking, I would say, because
Yeah.
you didn't even get to the
Yeah, that is
management.
because I didn't check the picture. That's why I was just asking for the clue.
But you've
Okay,
asked a
that's
lot
okay.
of
I
relevant
understood.
questions. Good job on that.
Yeah,
You
alcohols, but I didn't. I think
you
that
didn't
smoking alcohol is not
signpost.
important. Yeah.
It shouldn't have been important at this point. But then
Yeah.
even if you're asking, you should signpost. So that's why I was like, is this relevant? Why
Okay,
are you
like.
asking me all this? Because see, if I ask you, like, if I'm starting to talk to you about something, maybe you've come with an eye condition, or maybe you've come with a kidney condition, and then I ask you that, do you smoke? And then we're like, how is it related, doctor? I've come with you for the
Okay.
kidney condition. Why are you asking me if I smoke? Smoking affects my lungs, right? Why would it
Okay.
affect my kidneys? I mean, because that's their understanding, right? So you need to signpost it, especially to make,
Okay.
to get across to the person that I'll have to ask you a little bit about your personal history, which is relevant to this
Hmm.
consultation, right? So that way you're preparing them that it's going to be uncomfortable, because then they'll get offended and you will waste time, because they'll be like, why is this
Okay.
important, doctor? Why are you asking me all this? I don't smoke. Happy? Or something like that, right? So
Okay.
try to
Okay.
signpost, because you're trying to tell them that everything I ask you in this consultation is all important. I'm not trying to invade your privacy. That needs to be
Okay.
delivered. But all right, good job on this, and we'll look at the how you performed. Oh, sorry. All right, so uh, data gathering, I think you got full marks there. But
Okay.
the management took a big hit. But you need to understand, data gathering is 4 marks, management is 4 marks. So in asking one or two questions in data gathering, you're losing time for management, which is 4 marks. That one or two questions could give you like 0.5 marks, and you're sacrificing 4 marks for it. You know,
And
Okay.
if you're unsure, also don't worry about not knowing the diagnosis. That can happen. There will be stations where you won't know the diagnosis. So don't continue to data gather. As soon as you're done asking
Okay.
your questions, quickly move on. Just say that I'm not really sure what it is, but I'll find out. I'll ask my senior to come take a look. That's a very easy way to get
Okay.
at least 2 marks in management, because there's so much more you can do after that.
yeah, because even after that, I can give you, how about I set up a follow up
Mm.
once we confirm, so we
Hmm.
can do a further testing and we can understand what it is better, right? See, still the whole 3 things about follow up, safety netting, leaflets, pamphlets apply.
Hmm.
All these 3 things you can actually still do, even if you don't know your diagnosis. But then
Okay. I
management still be
understand.
getting points, right? Instead of asking more data gathering questions, you could go into management and say that I'm really unsure about what this could be at this point. How about I consult my senior? I'll ask my senior colleagues to take a look at it, and we can get to a diagnosis. But in my opinion, it can be, give
Hmm.
a range. If you don't know,
Okay.
the best thing is to give a range. It can be something as simple as a skin wart. You can say that. You don't know what it is, right? It can be a skin wart, or it can be as bad as a cancer, especially since your sister and father also had it. So since we are not sure, I do not want to give you any false hope, right? Especially since I don't know, we'll do further tests to understand better, right? And the further test, you can always say you can do biopsy, you can do some blood test and all that, because it's a telephonic conversation, so it's even better. Like, we'll call you in one of these days, let's arrange a follow up. I can send you some information on the web that you can search up, because over here leaflets and pamphlets you can't give, so you can give them some sites, some NHS sites and some links that they can look into, right? Some self
Okay.
examinations that they can do, right? So, couple of points:
Okay.
explain provisional diagnosis. Yeah, because seborrheic keratosis and all, sometimes you might not get it because they are also growing. A couple of features of seborrheic keratosis is their feel is waxy. So if they say they have a waxy
Yeah,
kind of
I
feel,
thought that is there is the changes. Yeah, that's why I thought maybe this is the malignant melanoma.
yeah, that's
Yeah.
true. But then they also growing, but very insidious, very slow growth, and this usually happens
Okay.
in people above the age of 40.
Okay.
Alright, couple of things about seborrheic keratosis. And sunbathing is definitely one of the risk factors, but it's in and out. Nobody's really sure about that fact, about the sunbathing part. But very good questions. You were pretty good with the questions. Like, do you have any other lesions anywhere else? You're ruling everything out. And you did ask the flaws. That's good. Because yeah, follow up with the dermatologist as well, because you've called the GP surgery, so you can always say that we can arrange a follow up, we can understand a little better. Before the follow up, we can have a meeting, I can speak with my consultant and find out what this could be. Yeah.
Okay.
Otherwise, good job again. I think there was one part where I had to repeat myself about something.
Okay.
Try to catch it in the first go, because if they mention, because most of the times that's what the simulators do, if they have to repeat themselves, they always say the
They
phrase,
get
I already mentioned this before.
it.
Because
Okay.
if they say that, that's an indication to the examiner to mark the listening, because they usually do that,
Okay.
because they are also trying to reinforce the fact that, didn't you hear me, you know.
Okay.
So try to have a comeback for that, say that I'm so sorry, I might have missed that, but thank you for reinstating that fact, or get
Okay.
back on that fact, because even though it's an indication to the examiner saying that she didn't listen to me the first time I said that, you're still being very
Yeah.
good about it, like, I'm so sorry I missed that, right? Try to have like that builds rapport. But yeah, good job.
Okay.
But one thing is, when you give the diagnosis, always give a provisional diagnosis. Never say never say you have this. Say I
Okay.
suspect you
Okay.
have this. Make sure you use
Okay.
that word I suspect.
Hmm.
So it's very important because that will give you a tick in the diagnosis, because you can never diagnose anything by just consultation.
And it's always
Mm.
provisional
Okay.
diagnosis at this point, because you haven't done any test to find out. You've
Mm.
only seen a picture and you've asked a few questions. You
Mm.
can't tell anything for sure if you've done that much, right?
So always, even if you're very sure, always just say I suspect this is this, but we'll confirm it. That's the
We
best
have to
way.
do some
Okay.
further tests to confirm it, right? Because you said you have melanoma, malignant melanoma. Like, it's like, what does that mean? I have what? So, again,
Okay.
another thing about saying the diagnosis, even though the diagnosis, you're going to have to say it in medical terms. Because, see, the thing about saying the diagnosis is, if you tell me that I have a condition, I would want to know what that condition is, because if my relatives ask me what it is, I will tell them this is malignant melanoma. Also, this will help me to do my own research. If I have to further check out what I know what to type into the net and find out what it is. But from your side, apart from saying the medical term, you have to also explain it in layman terms,
Okay.
right? Even if you suppose in the other case where it was like subarachnoid hemorrhage, bleed in the brain, malignant melanoma, it is
One
cancerous
type of skin
condition,
cancer. Yeah.
cancerous condition of the skin, right? Yeah, exactly. So that way you are giving them the medical term that they can search and tell people what it is, and you're also explaining what it is. Yeah. All right. All right. So Dr. Fatima, 3 down, 5 to go. How are you feeling?
Yeah, it's good because I'm learning my mistakes.
See, that's the thing. We are enforcing your mistakes, but we are not telling everything that you've done right. There are so many things that you've done right. So,
No, that
the
because I
judges.
need to know my all this. Uh, yeah, because very there are a lot of mistakes
I
that
mean,
you should correct me.
it's
Yeah.
it's never it's never 100% for sure. I mean, that's always the case. But don't worry, you're doing great, and we are always here to help. If you also have any doubts in the future, if you
Please like and subscribe to Turing Med School. Good luck with your preparation.